Magandang araw sa inyong lahat. My name is Dr. Leigh Reburon, and I will be your instructor for the subject Clinical Practicum 101B, and we will be focusing on the third and the fourth stages of labor. Before we begin, I would like to remind you that this session will only cover placental delivery and the postpartum period. I want you to watch this video while studying the printed module, so I expect you to be holding your handouts so that you can follow along the discussion. I also want you to manage your time well. Please allot 1 to 2 hours per day studying my module and watching my video so that you can finish all the reading assignments and watch the videos accordingly. Please focus your attention, minimize distractions, and if possible, turn off your phones while studying my module. Give it your best shot. Anong ibig sabihin nito? Remember that we are preparing you to take the board examinations, so please take all the quizzes, assignments, and other requirements as if they were needed for you to pass the board exams. Lastly, you also have to beat the deadline. I will be setting different deadlines, so please follow along in your Edmodo and be guided accordingly. Have patience. Alam kong mahirap po ang mag-aral dahil sa pandemic na ito because we are not used to this kind of setup. But as long as you become patient with yourself and pray that this will soon end, malalampasan nating lahat to. You also have to answer the tests with diligence and autonomy. Huwag mag-cheat as much as possible because we are preparing you for the board examinations. You have to motivate yourself. Isipin mo bakit mo ba kailangang mag-aral ng mabuti? Bakit mo kailangang graduate at maging midwife? Do you want to change the world? Do you want to become successful? Use those motivations so that you can finish the module with the flying colors. And lastly, if you have any problems, you can just connect with me through SMS, give me a phone call, or send me a message on my FB Messenger or on my email. Remember that I'm always here for you. I am your teacher, and we can get through this together. We proceed to the learning objectives on the care during the third stage of labor. Ano ba yung mga kailangan nating matutunan as midwives on the delivery of the placenta? Number 1, we have to know the different key terms related to the third stage of labor. Remember that doctors and nurses are using these terms when they are in the hospital. So it's important for you to be familiar and be knowledgeable of these words so that you can communicate with them properly when you become full-fledged midwives. We have to also explain and know the process of placental delivery or paano ba talaga natatanggal si placenta, and describe the steps of active management of the third stage of labor. We also have to know the different uterotonic drugs that are used on the third stage of labor, like your oxytocin and other drugs like that. We will also learn how to examine the placenta for its completeness, and you will also be familiar with the warning signs for complications that may arise during the third stage of labor. Kasi as midwives, you have to be very good at assessing and examining the patients and to be reporting these assessment findings to the doctor para malaman nila kung meron pang kailangang iba yung pasyente. Now, the third stage of labor is also known as the placental stage. Bakit siya tinawag na placental stage? Kasi ito ay nagsisimula on the birth of the infant and nag-end siya after the delivery of the placenta. So the main responsibility of the midwife here is to help the mother deliver the placenta as safely and as soon as possible. Now, this stage only lasts less than 30 minutes. Tandaan nyo lagi na this stage only lasts for 30 minutes because if there are events wherein the mother is having a hard time delivering the placenta at more than 30 minutes na, it will prompt you as a midwife. Sasabihin mo sa sarili mo, oh, more than 30 minutes na, kailangan ko na siyang i-transfer or i-report sa doctor. So you have to be very careful when it comes to the time of the placental delivery. Dapat no more than 30 minutes lang siya maide-deliver. Next, the placenta needs to be delivered by the mother because it has already served its function. Ano ba kasi yung silbi ng placenta? Di ba siya yung nagsusupply ng dugo, at oxygen sa bata while the child is still growing inside the uterus. But this time, the placenta is no longer needed because the baby is already out of the uterus. And leaving the placenta inside the womb of the mother may only lead to infection or possibly blood loss. After the birth of an infant, the uterus becomes firm and round. So anong ibig sabihin nito? The uterus will also have to contract. Magko-contract siya because it will signal the delivery of the placenta. Yung contraction na yon after the delivery of the baby will also signal the placenta to say it's time to go out. Okay? Now, the uterus will also be located on the level of the umbilicus. On this part, pagkapapakanak pa lang ng bata, you can expect that the uterus is in the level of your umbilicus. In Ilocano, patug ti puseg, iti ayan na ti matres pailaeng. Now, after delivery, the uterus will begin to contract again. And these contractions are generally a mechanism of the woman's body to expel the placenta out of the uterus. Gaya ng sinabi ko kanina, the uterus will have to contract again because ito yung magpupush sa placenta palabas sa matres. Okay? And it is not safe for a midwife to deliver a placenta in a relaxed uterus. Dapat bago mo ilabas si placenta, nakakakita ka na meron siyang contraction. Next, there are 3 phases in the third stage of labor. At ano-ano yung mga yon? Number 1 is what we call the placental separation phase. The placenta needs to be detached from the uterine wall before it is removed. So kailangan, alalahanin nyo ha, yung placenta po ay nakakabit sa uterus. Okay? Now, before the placenta is expelled, kailangan muna nilang maghiwalay si uterus at si placenta. Now, paano sila maghihiwalay? By clumping and cutting the umbilical cord, this now signals the separation of the placenta and the uterus. So pag clinamp mo na yung cord, what will happen? Yung bleeding, yung dugo na pumupunta dapat sa baby, di ba kinat mo na po? Okay? Magpupul na doon. Magpupul or maiimbak sa may placenta kasi wala na silang pupuntahan. Mag-overflow ngayon yung dugong yon. And that is now what we call your retro-placental hemorrhage. Sa likod ng placenta, kung saan nakakabit siya sa uterus, magkakaroon doon ng bleeding. Alright? And that bleeding will now push the placenta and will help separate the uterus and the placenta. Kailangan yung tandaan, as midwives, to be patient and watchful in waiting for the signs of placental separation. Hindi dahil sa sinabi nating tinutulungan dapat natin yung nanay to deliver the placenta, hila na kayo ng hila sa umbilical cord. Hindi po ganun yun. Dapat you have to be watchful in waiting for the signs of placental separation. Kailangan munang maghiwalay ni placenta at ni uterus bago siya ilabas. Now, what are the different signs of placental separation? Number 1 is what we call the sudden gushing of blood or makakakita ka ng dugo na lalabas bigla from the uterus of the mother. Ito yung tinatawag natin kanina na retro-placental hemorrhage. Okay? The active bleeding on the maternal surface of the placenta begins the separation phase of the placenta from the uterus. So, paano siya nagkakaroon ng retroplacental bleeding? Dapat we clump and cut the cord. Okay. So, ano yung midwifery responsibility natin? Dapat, we should watch out for the sudden gushing of blood from the mother's vagina. So, pag tinitignan natin, wala pa siyang dugo, it is the placenta and uterus has not yet separated. But pag nakakita tayo ng sudden gushing, biglang merong umagos na dugo from the vagina of the mother, this means that the placenta is starting to separate away from the uterus. Now, kung titignan natin dito, this is the, letter A is the normal na nakakabit pa lang na placenta. Ito yung tinatawag natin na, okay, point wherein the placenta and the uterus connects dito po. Okay, ito yung nag-absorb ng dugo from the uterus. But once na-clinump mo na yung cord na ito, yung dugong pumupunta from the placenta to the baby will now have nowhere to go. Hindi na sila makakalabas kasi nga clinump mo na dito. So what will happen? Yung dugo na pumupunta dapat kay baby, hindi sila nakakalabas, nagpupul siya. Anong ibig sabihin? Nag-overflow. And then magkakaroon ka ngayon dito ng retro-placental bleeding. And now that will separate now the uterus and the placenta. So makita nyo dito, nagse-separate na siya because of the retro-placental bleeding. Right. Now, after the separation of the placenta, kailangan na niyang bumaba so that it can be delivered. So now, that is the second stage, which is the descent of the placenta. Sabi ko kanina, after separation, the placenta moves down from the top part of the or fundus of the uterus, going down to the birth canal through the dilated cervix. At makakakita din tayo ng mga different signs dito to let us know that the placenta is already descending or bumababa na siya. Number 1 is the lengthening of the umbilical cord. So makikita mo yung umbilical cord ng nanay na nagpipeek through from the vagina will also lengthen. So sabi dito, when the placenta has completely detached from the upper segment of the uterus, the placenta and the umbilical cord sinks down to the lower uterine segment. So dahil sa hindi na nakakabit si placenta, bumaba na siya from the fundus, pababa na siya doon sa corpus or body of the uterus. So ibig sabihin, nagle-lengthen na din si cord. So what is our midwifery responsibility? You observe the lengthening of the cord. So pag nakita mo na humahaba na yung cord ng nanay, okay? And it actually occurs after the sudden gushing of blood, it is vital that you do not tug or pull the umbilical cord. Dapat hindi yun hinihila. Okay? Especially if there is resistance. Ano bang ibig sabihin ng resistance? Pag hinihila mo siya at yung placenta nakikipaghilaan sa'yo, that means that it is not yet fully separated. Hindi pa siya gaanong nakakapag-separate or may mga parts pa dun sa placenta na nakakabit pa sa uterus. Now, following the descent of the placenta, makakakita din po tayo ng Calkin sign or the change in the shape of the uterus. Kung kanina po nakakonect ang ating placenta sa uterus, dito naman po sa Calkin sign, the uterus will now be globular in shape. The placenta sinks down and it goes lower to the lower uterine segment. And because of this, it can be observed that the uterus becomes globular in shape. Kanina, yung uterus ay nandoon sa level ng umbilicus mo. Ngayon naman, it is located on the symphysis pubis. Anong ibig sabihin nito? No tatay puseg ti kabatog na ni uterus, tatamiten pusong ti ayan na dejayanti shape na deja uterus. So that is a sign that the placenta is already detached and descended towards the symphysis pubis. So what is your midwifery responsibility? As the uterus takes a globular shape, you, as the midwife, should try to palpate the hypogastric area. The hypogastric area is what we call pusong in Ilocano. Okay? You have to palpate it and feel for the placenta to make sure that the placenta is really descended. Now, as discussed a while ago, after the delivery of the child and the beginning of the third stage of labor, the placenta is still connected on the uterus. So dito po. So makikita natin na yung bukol is just below the umbilicus. Pero pag nag-descend na po si placenta, okay? Bumaba na si placenta kasi nag-detach na siya, the buccal, okay, or the globular shape of the uterus is already seen on the symphysis pubis. Ito po yung navel. Okay? So makita nyo, mas mababa na yung location ng placenta ngayon. And ito yung tinatawag natin na Calkin's sign, or the uterus becomes globular in shape at nakikita yon on the level of the symphysis pubis. And now, if the placenta is already fully delivered, makikita nyo na empty na si uterus, so that will now become the appearance of the uterus. Now, remember that the firm contraction of the uterus is always present when the placenta is being delivered. The separation of the placenta from the maternal surface of the uterus leads to active bleeding kasi. So yung nakikita nyo kanina na mayroong connection point si placenta and uterus kung saan nakakonect yung mga blood vessels, di ba? Magdudugo yun. Okay? So what will happen? Kailangang mag-contract ni uterus so that the blood vessels that are open will become ligated or closed para hindi magkaroon ng bleeding si nanay. Okay. So like I said a while ago, the active bleeding will now signal the contraction of the uterus to prevent maternal bleeding, because when the uterus contracts, it closes the active blood vessels where the placenta was previously attached. Also, pag magko-contract si uterus, it promotes the expulsion of the placenta. Meaning, the upper segment of the uterus sa may fundus, di ba doon yung center ng contraction, it will contract and help push down the placenta for expulsion. So, makaka-expect kayo ng contraction ng uterus if the placenta is now ready to be delivered. Next, we also have the appearance of the placenta at the vaginal opening. So when you will go for duty and you are assisting the delivery of the placenta, makikita mo siya sisilip si placenta on the vaginal opening. So after placental separation, the placenta is delivered either by natural bearing down effort of the mother or by gentle pressure on the contracted uterine fundus by the midwife. So always remember even without the assistance of the midwife, the body can still expel the placenta out because of the presence of these contractions. However, we need to be there during the delivery of the placenta to, as much as possible, manage or prevent complications that are related to the third stage of labor. So, after 10 to 15 minutes of watchful waiting and assisted placental delivery, the placenta will now peep out. Di ba? Bumababa siya kasi from the fundus, nag-descend siya, and now it's in the vaginal canal. So magpipip out siya from the vaginal opening. So that means that the placenta is now ready for expulsion. In connection to what I discussed a while ago, ito yon, the appearance of the placenta at the vaginal opening. So, di ba bumababa na siya? So, normally, ang makikita po natin is magpipip out itong part na ito. Masisilip natin siya. And that will now signal us that it is ready to be delivered or expelled. We have different mechanisms of placental separation. Okay? So, paano naghihiwalay si placenta from the uterus? Number one, we have your Schultz placenta. It is the most common way of placental separation. Pinakamaraming mga pasyente natin is merong Schultz placenta. Anong ibig sabihin nito? This happens when the placenta separates first at its center and lastly on its edges. And the placenta will fold on itself like an umbrella. So kung makikita natin dito sa picture na ito, nandito yung retro-placental bleeding. Alright? Sa center siya, unang nagse-separate. So what will happen? So pag magde-detach sa dito, okay, susunod yung mga ibang organs, so mga ibang cotyledons ng placenta, what will happen? So pag magde-deliver siya, makikita mo that you have this side. Okay? Yung side na kung saan nakatira si naka-envelope kay baby, ito yung unang lalabas. Okay? Lagi niyong tatandaan na ang Schultz placenta natin is shiny and glistening. So nagbibiruan nga kami na yung Schultz presentation nagsisimula sa letter S and that stands for shiny. Okay? Because, bakit? Bakit siya shiny? Because the fetal membranes are the ones more exposed to the midwife. So makikita natin na ito yung nakakabit kasi sa baby. And itong side naman dito, yung nandoon na nakakabit sa uterus. So dito, mas pangit yung itsura. Mas dirty yung itsura nito. Pero dito, ito yung nakikita mo kasi this is the fetal side. Dito mas shiny. Okay? So aside from that, this type of placental separation generally has less bleeding, and the point where the umbilical cord and the placenta connects is also visible. So, sa Schultz presentation natin, makikita mo din ito kung saan nag-connect si umbilicus and sa placenta. So, pag nakikita mo yan, that means that the separation, it's what we call the Schultz placenta. We also have the second mechanism of placental separation. At ang tawag natin doon is Duncan Placenta. Now, this type of placental separation is less common. And the placenta separates first at its edges. So, kung makikita nyo po dito, kung kanina sa center siya nag-separate, dito naman sa gilid-gilid. So, kita nyo, nandito siya unang nag-separate. So, what will happen? Magse-separate siya dito until ang lalabas po ay yung dirty side or the maternal side of the placenta. The placenta appears raw, red, and irregular because the maternal surface of the placenta is the one exposed. So, dito po kasing side na ito ng placenta, dito po maraming mga blood vessels, ito po yung nagko-connect sa placenta and uterus. Ito po yung reason kung bakit nakakapag-absorb si placenta ng dugo from the mother towards the baby. Now, pag yan yung lumabas na nauna, ibig sabihin that is the Duncan presentation. So, kanina, shiny Schultz, ngayon naman, dirty Duncan. Okay, it appears raw, red, and irregular. So, hindi siya kaaya-ayang tignan. Now, so ganyan po yung itsura ng ating Duncan presentation or Duncan placenta. This type of placental separation is generally more bloody. Bakit? Kasi nga ito yung side na nag-absorb ng dugo from the mother. So you can expect that there is more bleeding when it comes to this kind of placental mechanism of separation. Ano pa? The cotyledons are also exposed, and the point where the umbilicus and the placenta connects is also not visible, unlike sa Schultz presentation. Now, sa term na cotyledons, ano po yun? Ito po yung mga segment ng tissues like this, cotyledons. Ito yung mga segment ng mga tissues that are seen in the placenta that absorb blood from the uterus. So ito po yung mga cotyledons na ito. And according to Adele Piliteri, there is approximately 16 to 18 cotyledons in a normal placenta. Ito yung tinitignan natin, okay? Para masabi natin na kumpleto yung placenta or hindi. Alright? Alam nyo ba na ang normal placental delivery ay nagkakaroon ng blood loss si nanay ng 300 to 500 ml. And that is still considered normal. Now, gaya ng sinabi natin kanina, kailangang magdugo ng likod ng placenta or what we call the retro-placental hemorrhage so that the placenta and uterus can separate. Now, this bleeding occurs as part of the normal consequence of the placental separation, and the bleeding will only signal the uterus of the mother to contract so as to close the uterine blood vessels. Ang tanong siguro, sir, bakit naman meron siyang boba milk tea dito? Kasi ganyan kadami po ang 500 ml. Halos isang serving ng milk tea nyo. At bakit siya merong mga boba or pearls? Because we can also see that sometimes the mothers will expel blood clots during placental delivery. So that's just one trivia. Alalahanin nyo ha, ang normal na blood loss during placental delivery is 300 to 500 ml. And that's still considered normal. We also talk about the placental expulsion phase. According to Adele Piliteri, the placenta can be expelled by the mother using the natural process of maternal bearing down. Anong ibig sabihin nito? The mother can still expel the placenta even without the help of the midwife by just relying on her maternal instincts of natural bearing down. In Ilocano, pinagidek, or in Tagalog, pag-ire. So the mother can still expel the placenta by just following her maternal instincts. Aside from that, the placental expulsion can also be helped by the gravitational force. So hihilain ng gravity yung placenta pababa, and that is also one way of naturally expelling the placenta, or through a series of procedures that is done by a skillful midwife such as yourself in the future. Kaya natin siya pinag-aaralan ngayon. Now, the first maneuver that is related to placental expulsion is what we call the Brandt-Andrews maneuver. It is a technique for expressing the placenta from the uterus during the third stage of labor. So anong ginagawa natin dito? One hand puts gentle traction on the cord. So hinihila ng isang dominant hand mo yung cord downwards, while yung non-dominant hand mo presses the anterior surface of the uterus. So anong ibig sabihin nito? Hinihila natin pababa si umbilical cord while we are also pressing down gently the uterus backward. Bakit? Kasi ayaw nating mahila din natin si uterus palabas ng matres. Now, this maneuver is also known as the controlled cord action. At paano pa siya ginagawa? So like I said a while ago, yung isang kamay mo, yung dominant hand mo po, is hinihila yung umbilical cord pababa. Alright, this one. And yung non-dominant hand mo will have to push the uterus upward and backward para hindi siya mahila ni placenta palabas. So let's read the steps explained by Adelphi Terry. This is done by pulling gently the umbilical cord downward when the uterus contracts. So very important po yung term dito na the uterus is contracting. Bakit? Because we will only deliver the placenta if there is active contraction of the uterus. Why? Because if it is relaxed, there is a possibility that the uterus will also go out of the vagina along with the placenta. And that is one common complication of the third stage of labor. So sabi dito, number 2 step, at the same time, while pulling gently the umbilical cord, the other hand guards the fundus of the uterus by putting your hand on the abdomen. To avoid causing the cord to break, para hindi mapigtas or mabali yung ating umbilical cord, make sure that you do not pull very hard on the umbilical cord. If there is resistance, what do? Stop pulling and wait for the next contraction to arise. Like I said, we need to have a contracted uterus before we deliver the placenta. And then the cord will eventually loosen and then you can pull the placenta down using the cord. So ganun lang po siya kasimple. Ulitin natin ha. The first step is your non-dominant hand will hold the umbilical cord and pull it downward. And simultaneously, yung non-dominant hand mo naman will have to push gently the uterus backward and then you pull gently. If there is resistance, do not pull. If there is a relaxed uterus, do not pull. So that is the concept related to the Brandt-Andrews maneuver. Right. So that's the Brandt-Andrews. We also have the Creed's maneuver, and this is executed by exerting manual pressure on the postpartum mother's abdomen at the location of the bladder just before the navel or the umbilicus. So anong ibig sabihin nito? Like in your Brandt-Andrews maneuver, we apply gentle pressure on the fundus of the contracted uterus, pero ginagawa siya usually by the physician, the nurse, or a midwife. And this is done to gently assist the expulsion of the placenta. So ano naman yung focus natin dito? Dito naman, our focus is pinching. So di ba sa Brandt-Andrews maneuver is we are pushing gently downward the uterus. Dito naman is we pinch. Okay? We pinch the fundus of the uterus para hindi siya lumabas. The fundus of the uterus is pinched upward and backward by the midwife's non-dominant thumb and forefingers. Ito po, yung thumb and forefinger ng nanay, ng midwife, while the dominant hand pulls the cord downwards. So ultimately, the Brandt-Andrews maneuver and the Creed's maneuver look the same. Same concepts din, but we apply different techniques. Yung isa, pushing downward lang. Ito po, may pinching. Okay? May pinching na involved in the delivery of the placenta. After the delivery of the placenta, it is the midwife's responsibility to call out the time of placental delivery. Okay? Bakit natin kailangan gawin ito? This is done to inform the rest of the team regarding the data needed for proper documentation. Always remember that it is very important for us midwives to be documenting what we see, what we do, what we observe in the patient's case. Okay? So you call out the time of placental delivery so that the rest of the team will also know what to document. Example, lumabas si placenta at 12:15 p.m. So what do? You call out, placenta out at 12:15 p.m. It should be strong and loud and concise and brief para alam ng lahat yung kanilang idodocument. That's one responsibility. Next, the placenta should not be immediately discarded. Hindi yan dapat agad-agad pinupunta sa basurahan. After the delivery of the placenta, it is the responsibility of the midwife to inspect the placenta for any tear, any cut, or incomplete cotyledons or segments. So tinitignan natin or ini-inspect natin yung placenta. If the midwife noted any tears, cuts, or missing segments, you notify the doctor immediately. Pag nakakita ka na ng incomplete cotyledon, kunwari meron kang missing dito, makikita mo naman siya, it's very visible, kunwari ito missing, right? And then the rest, kumpleto naman. What do? You notify the doctor immediately. Bakit? Because the doctor will perform manual extraction of the retained placenta. The doctor will insert her hand inside the womb of the uterus and kukunin niya dito using manual evacuation of the uterus. Kailangang matanggal ng mga placental segments na trap or hindi natanggal in the uterus because if we do not remove it, it will cause the relaxation of the uterus. Hindi magko-contract ang inyong uterus kung meron siyang retained placental fragment. Aside from that, magkakaroon din siya ng continuous bleeding which may eventually lead to death. Aside from that, magkakaroon din siya ng uterine infection. So it's very important that you report any missing cotyledon, any tears, any cut that you see in the placenta after your delivery. And then report immediately to the doctor para matanggal nila through manual evacuation or extraction. And that concludes our first pre-recorded video lesson. I hope you enjoyed the class as much as I did. I'll have to make an assessment on how much you have learned on our session together. So I'll be uploading a quiz on our Edmodo class. However, for those of you who have not yet connected or logged on to Edmodo, I will just have to send the quiz via Facebook or you can just call me so we can arrange something so that you can still take the test. Again, maraming salamat. Keep your social distancing, wash your hands, and wear a mask. Keep safe, keep healthy. God bless.